Oftentimes when somebody has a stroke or an injury to their brain, they are left with a condition that's known as left neglect, which is an inattention to the left side of their environment. It's not necessarily a visual problem in that their eyes can't see it, but their brain just cannot process the information in the left side of their environment. And it can be very severe to where somebody's head is literally turned to the right, or it can be sort of minor deficits, where it's just something in the periphery is not attended to by their brain. And so we can do what we call musical neglect training, which is actually using music and auditory stimulus to address a sensory deficit in vision, with great results. So as you see in the video, we have what's called musical neglect training, where I'm using handbells, where we set up a rhythmic and melodic pattern that initially starts from the right and goes to the left. The patient can hear the melody, and then they themselves have to play the melody on the handbells. So we set it up from right to left, so as they complete the melody, it has to drive their attention to the left in order to complete it successfully. At that point, we can actually reverse the direction of the melody, so the melody starts on the left side, and they have to drive their attention to the left to initiate the pattern from left to right. And so traditionally, the task that is used is a line cancellation task, where there's a piece of paper set in front of the patient with individual lines from right to left. And the patient is asked to cancel or to cross all of the lines that they can see. Typically, somebody with left neglect does not recognize any of the lines that are on the left side of the paper. And this is what's done as an assessment to see how they're functioning and what their level of neglect is. Post-music neglect training, what we actually see is that people are actually able to cross out more lines to the left, so farther to the left, and with a lot faster pace. And therefore, we have a non-musical outcome for a musical intervention that is highly functional for these patients, which can be translated to activities of daily living, which could be eating or reading. As you can imagine, reading is left to right. So being able to acknowledge things that are on the left side of the environment can be very important for those tasks, but also for their safety, so that they can see things in their environment. So one of the most exciting things about being a neurologic music therapist right now is that, and especially in a hospital setting, is that I get to collaborate with a lot of different people, from the therapist to doctors and even an optometrist. And here with music neglect training, the way that optometrists typically treat left neglect is they have prism glasses. And prism glasses are glasses that have thick prism lenses that actually shift somebody's attention more to the right. So their field of view and their idea of center is actually further to the right, opposite where the left neglect is. So they do training with these prism glasses on, and then when they take them off, their brain sort of overcorrects and they shift their center of midline past midline further to the left. And so we have these glasses that we use in co-treatment with optometrists. And we've seen that once we do music neglect training with these prism glasses on, that we see even greater results. And the optometrist told me after seeing music neglect training in action that we have in our hospital one pair of these glasses. And he gave them to me because he said every single person that gets diagnosed with left neglect in the hospital is going to get a referral for neurologic music therapy because what you do works best. One of my proudest moments thus far.